Cape Media News Conversations, I'm Sarah Colvin. We continue to battle the opioid crisis here on Cape Cod and nationwide. Joining me in studio to talk a little bit about the challenges of legislation, what's being worked on, and the hopes of what can be done, I'm pleased to welcome State Representative Tim Whelan here in studio. Tim, good morning, and thank you so much for joining me.
Good morning, Sarah. It's always my pleasure, and you'll forgive the fact, please, that I'm a little hoarse this morning. It's a little slight change in the weather, so but we'll soldier through and do our best.
That's right, and you've been doing a lot of work on criminal justice reform, and I know you spent the morning on the phone, so I appreciate you.
Soldiering through and doing our best for our citizens, absolutely.
Absolutely. So let's talk a little bit about the opioid crisis, and I think you have an interesting perspective on this, of course, because you come from a long career in law enforcement, and now you're on the legislation side. So tell me a little bit about kind of big picture what you're seeing in terms of the development of the crisis here on Cape Cod and really in Massachusetts.
Well, what I'm seeing with the development right now is when I first moved to the Cape a number of years ago, the usual suspects were at play in the illicit narcotic world, and we would find when people were arrested, and that would be cocaine, some crack cocaine, marijuana, which is now legal, no longer considered to be an illegal substance, and but pills. Pills were the big thing. Lots of Oxy on the streets. And then we saw as the availability of OxyContin became less and less, we saw the growth of heroin. As heroin continued to overtake the world of narcotics down here from pills because it was a lot cheaper and then it became more available, what we started to see after that was we started to see the emergence of synthetic narcotics. And this is where we start crossing into even more dangerous ground. And those synthetic narcotics would be the deadly narcotic known as fentanyl, which is now pretty much overtaken the market, certainly in Massachusetts and in many parts of the nation. As well as now we're seeing the emergence. There have been 12 tests in this country, 12 tests in Massachusetts, field tests that have revealed carfentanil, elephant tranquilizer, which is 5,000 times more potent than heroin.
My goodness.
5,000 times with a fatality overdose of 20 micrograms. 20 micrograms of this product will cause someone to go into overdose. And generally there's not enough Narcan available that could ever be injected in a period of time to save human life at that point.
And are folks going out seeking this carfentanil, or is it something that's being mixed in with something that people think is heroin or think is fentanyl?
This is, it's being mixed in. People, they're not purchasing from a compounding center or a USDA approved lab. This is stuff that people are mixing up. They're mixing up in back rooms and mixing up in garages, and whatever is available is driven solely by its saleability in the marketplace as well as its profitability. Again, when we're talking about a synthetic opioid like carfentanil, 5,000 times more potent than heroin, that means that 1 gram of carfentanil is equal to having to transport 5 kilos of heroin, 5,000 times more potent.
My goodness.
So the profitability, the way that you can take that 1 gram of carfentanil and that you can cut it, thin it out, which you have to do anyways, at least 5,000 times to one, so that you're not killing everyone. But they really don't care. But they try to. But that again, it's not an accurate lab measurement. The profitability of these narcotics, which since they're synthetic, they're easier to get in this country too. Is what drives the marketplace. And that's why these evil people who are trafficking in these narcotics, they're driven solely by their greed for the dollar and with zero concern for the welfare or the lives of the people who are purchasing their product.
So you've got a synthetic opioid that is relatively easy to make, relatively easy to get your hands on, huge profit margin, major potential for death. So this certainly is terrifying to me when you think about all of those factors coming together. It's dangerous for the people out in the streets who are looking for their fix, and it's hugely profitable for the drug dealers. So certainly they have motivation to keep going on that. And again, you're saying these are being made in people's garages, things of that nature. And I'm sure in terms of legislation and criminal enforcement, it's difficult to track these folks down.
Sure, it's being mixed in people's garages. It's being manufactured, carfentanil, and then there's another new synthetic that we're seeing on the streets here on Cape Cod, speaking with my friends in law enforcement. That's known as Pink Death. The lab name for it is U44770. These are made in China, and they are shipped to the United States. In the case of Pink Death U44770 was being made by Qing Labs in China, was being shipped to this country until the DEA got on top of it. Addicts were able to use their credit card, and they were able to go online, order this product. It's 4 or 5 times more potent than heroin. They were able to order it online, have it shipped to their house, and have it available for use or available for sale within a week. And there was nothing that the government could do to stop it. So now, DEA has made it illegal on the federal level. We haven't dealt with it on the state level yet, although we are having conversations. I'm having conversations with the Judiciary Committee on it right now. In recognition of that, Qing Labs in China has changed the formula a small bit, and what was U44770, it's now U44880. Not illegal, being shipped to this country, and DEA is working to get ahead of it right now too.
And do we see that happen frequently, where these synthetics the formula is slightly changed, so that when one formula is made illegal, they slightly change the formula, and then that's legal again?
You're exactly right, Sarah. So what a lot of states do is we try and deal with it by passing legislation to deal with the analog, the base foundation of the narcotic, so that if they change one little isomer, one molecule. But the problem sometimes with this legislation is getting the court to accept it. You have to bring in 2 or 3 chemists to explain the chemistry to a jury, to a judge, and have them accept it. So it makes it a little more difficult. DEA is certainly leading the way on fighting these synthetics because they have a 30,000-foot view. They're seeing what's going on in Arizona, they're seeing what's going on in Florida, they're seeing what's going on in other parts of the country, and they're able to administratively insert some of these controlled substances when they pop up on the radar into their schedule of controlled substances. In Massachusetts, it's a more difficult, more unwieldy process. We have our own list of controlled substances in Chapter 94C, and we have to work to, as we did with fentanyl in the past, and we're working right now on carfentanil to get it in there. We can sometimes take months to get stuff in there. I filed legislation to make carfentanil illegal, and that was filed with my friend and colleague Paul Tucker from Salem. We filed that almost 6 months ago, and it looks like we're finally going to be getting it through, hopefully before the end of the year. So you're talking 6 months.
Now, why does it take so long? I mean, obviously the DEA has a little more leniency in the ability to put things on their schedule, and as you said, that kind of interacts with the way the state does it. But why isn't, once it kind of goes on the radar of the DEA, why isn't that kind of more widely accepted? I mean, obviously legislation takes a process, but to me, especially as we're dealing with this crisis, it seems interesting. It feels like things like this should be a little more fast-tracked.
That's a fantastic question, and very poignant question, Sarah. The Governor Baker, is right now trying to deal with this. He filed a bill a couple of months ago in which he seeks to have Massachusetts, instead of having our own list of narcotics in Chapter 94C, his bill seeks to have us adopt, as New Hampshire has, the DEA schedule of controlled substances. Of course, in doing so, we would not we would not include the restrictions on cannabis, cannabinoids, and everything else that was approved by the voters in ballot question 4. We would remove those. So exclusive of those, we would adopt the DEA schedule of controlled substances. And I firmly believe that's the best route to follow to protect our citizens from the scourge of these narcotics. The idea that right now we have people on the streets that can sell Pink Death, that can sell carfentanil, it's not illegal, they can sell it on the steps of Beacon Hill, and there is nothing we can do about it. My good friend, DA Tim Cruz from Plymouth County, I was with him last week, and he had explained to me they had arrested people. I think there were 2 or 3 cases in Plymouth County where people were distributing carfentanil. When it came back from the lab that it was straight carfentanil, they had to drop the charges.
Really? And I'm sure that just makes it incredibly difficult and stressful for our law enforcement and as you travel through the criminal justice process to be able to get this, to get it to stop. I mean, I think the bottom line is people are dying, and that is the biggest concern. There's so much, crime that goes around it, but the bottom line is people are dying. I mean, I think in the town of Yarmouth alone, they've responded to more than 100 overdoses just this year alone. And it seems like those numbers just keep increasing in our towns here on Cape Cod. And until I think, it's one thing to be able to go to a drug dealer to get heroin. It's an entirely other thing to be able to go online and order something from China and not have to have the threat of, being caught or having to go undercover. It's just you push a button and it gets delivered right to your home.
It's a whirling dervish of evil. And as I remind my colleagues in the State House, and I remind my former colleagues in law enforcement, say we have people right now, the addicts themselves, that are enslaved in their addiction. And think beyond that, and think every one of these people that's enslaved in that addiction, every one of these names of these victims who we've lost to overdose, they have a support network and a family around them and people that care or cared about them very, very much. So in going forward and trying to think not just of the addicts and trying to save them, protect them, and return them to a healthy life, but their families. There are 2,000 plus people that will be recorded as overdose deaths in Massachusetts, 2,000 grieving families. Think of the children of these addicts, the parents of these addicts, the significant others of these addicts. It's heartbreaking. And
the community, everyone that surrounds them. And again, it just seems like it's getting worse. And we mentioned earlier, obviously, you had a long career with law enforcement as a state cop, as a police officer. Have you ever seen anything like the environment that we're operating in right now when you were out in the field? Certainly not with the death, not with the overdose death. Addiction has been around for a long, long time. I mean, one thing that's well recorded is that alcohol addiction, which affected my family as well as many, many families. Alcohol addiction has been around as long as men have been making wine from grape. Sure. The narcotic addiction, back when I started in law enforcement in the 80s, the potency of heroin was somewhere around 5 to 10%. And back then, the significant number of people that I saw working in corrections that were trapped in addiction were people from inner city communities, as well as a lot of Vietnam veterans. An awful lot of Vietnam veterans that I used to see that were self-medicating. And again, this is back in the 80s. Then heroin and cocaine were big. Then we started to see the addiction grow, and I don't know how strongly it affected the Cape, but certainly Springfield, Worcester, we started to see crack cocaine. Crack cocaine took over a lot of these inner city communities, and it was frightening, the level of addiction that we saw. But the amount of death, the loss of life was nothing like what we're seeing now. This is truly an epidemic. It's a public health crisis. Whatever label we can put on it, it's not enough. Again, over 2,000 lives. 2 years ago, I made my maiden speech on the floor of the House of Representatives, and I'll never forget telling my colleagues we were discussing fentanyl. And big surprise, I discuss these things all the time. We were discussing fentanyl, and I was bemoaning the fact that we were going to have 1,400 lives lost to addiction that year. That number's grown over 2,000. My goodness. And that's just in 2 years. And it has to stop. We have to do more. And certainly, we know alcoholism is, I think the Barnstable County report that came out several years ago called it endemic. It certainly still remains the top addiction on Cape Cod, but I think you can unfortunately have a long life as an alcoholic and many years of abuse. But I think the dangerous thing about the opioids, again, is just that potential for death, that potential, especially with the fentanyl and the carfentanil, just a little bit can kill you. And it's terrifying when we think about children, and it's something that affects people across the spectrum, whether they're young people, old people, rich people, poor people. It does not discriminate. So when we look at what we can do legislatively, do you feel like we are making, excuse me, do you feel like we're making strides? Are there things that are being done on Beacon Hill that can help the problem?
Now, looking at it legislatively, two different directions in legislation would be budgetary and changes to the state law. I can tell you, I've been working very closely with the chairwoman, Chairwoman Cronin from the Joint Committee on the Judiciary. She's the House Chair, and she has been absolutely fantastic. She's been a leader, very, very involved in trying to find how we can best combat addiction, what we can do to, for instance, with carfentanil. She and I have been working very closely along with Representative Tucker and House leadership to make sure that we get carfentanil included into an omnibus crime package. This bill was released yesterday. Had a chance to look through it, and I'm proud to see that carfentanil is, according to this bill, once we debate it next week, if we get it through and signed by the governor, then carfentanil before the end of the year will be a controlled substance in Class A. Having ongoing discussions with her with the other synthetics, as we were discussing, U44770, U44880, and other opioids as they may pop up, as well as we are already discussing going into the beginning of next year, topic which we were just talking about, which is the state adoption of the DEA schedule of controlled substances. Discussing it, which means I get an opportunity to advocate for it, which I think, again, based upon 30 years of practice in the field, is by far in the best interest of our citizens. So that's on the legislative front. Republican leadership, Democrat leadership in the House have been fantastic, and they're all behind this. Addiction's touching every one of our communities, and we recognize our responsibility without question. Come April, we have to see how the budget picture works out. We need to put more money into treatment. We need to put more money into prevention. This is not something that we're going to be able to enforce our way out of. We have to cut down on the demand. We have to stop the next round of addicts from developing by educating them on the perils of addiction. We also have to expand the availability of treatment beds, particularly here on Cape Cod and on the islands, where there is next to none, to get people that right now are sick, to get them healthy. And it supports them in getting healthy if they don't have to go 150 miles inland from home to get healthy. Keep them close to their family so they can support them through their addiction.
Absolutely.
We have a couple of issues with state government that we have to work through to be able to free up some money, and that would be the cost of health care. Right now, 52% of the state budget is consumed to pay for health care through Mass Health, the Health Connector subsidies, and employee and retiree health care. So we have another omnibus package we're going to be looking at and dealing with, trying to contain health care costs. And the idea is hopefully we'll free up some money from that, and that will allow us to invest more, put more investment into prevention and into treatment and recovery.
Of course, and there are so many barriers, and I think as long as we're living in a world where it's easier for folks suffering from addiction to get their next fix than it is to get into a bed, we're still going to see that continue. And I'm curious about kind of defining addiction as a disease. I think that's been a debate for a long time. Of course, if you have cancer, they're not going to question you. If you're going to get admitted to the hospital, you're going to get the treatment that you need. Your insurance will help to pay for it. If you're an addict, you're kind of out of luck when it comes to that. And it's tens of thousands of dollars, and sometimes hundreds of thousands of dollars for treatment that only has 17, 18, 19% success rates. So taking a look at that whole treatment system, it's not easy.
You're making a great point, Sarah, because when you look at what we're doing right now, it's being penny wise and pound foolish, because we have addicts right now, and you talk to our dear friends that work hard every day in our fire departments, our paramedics, they're picking up addicts 2, 3, sometimes 4 times a week or more, and dispensing Narcan, transporting them in an ambulance, taking them to Cape Cod Hospital. And that's paid for by the taxpayer.
Right.
Then if that person commits a crime or is arrested and goes to jail, we're spending anywhere from $34,000 to $46,000 a year to house them. If we were to make Vivitrol available to them, get them into a treatment program, and get them the support that they need to recover, now they become a tax-paying citizen. Now they are pulling the wagon instead of sitting in the wagon. That, to me, I think is the approach that we have to look at. And we get the dual benefit of saving our citizens and saving the taxpayer.
Right, and it's almost like you look at that one big expense for treatment, you get a little nervous, but then you add all the times all the money it takes when the police go out on a call, or when the EMS has to respond, or the hospital has to respond, and you add those up, and that's a much bigger number. You mentioned Vivitrol. I know that the Sheriff's Department has had a lot of success.
Our sheriff has done, he's been a leader. He's been a leader in this. Sheriff Cummings has done an outstanding job. And, you look at sheriff's departments from around the country that are coming here to see what we're doing in Barnstable County. I just can't say enough good things about what he's doing. And he was a leader, as you said, in the Vivitrol program. Absolutely.
And of course, we've mentioned Narcan a number of times, and that's something that all of our police departments have now. Many of the officers are trained. Of course, our emergency response folks have that. Do you think that's making a difference? I mean, it's saving lives.
It is, and I wouldn't trade in Narcan. I hear some of the pushback from people. I have taxpaying residents that live in my district that ask me when the government's going to pay for EpiPens. And listen, I hear that. I understand that. We can't just dismiss, what Narcan has done to save lives. A number of people that have gotten into recovery are healthy and are now contributing to our society, were at one point in their life an addict and had their life saved by Narcan. And again, I think of the families. I have routinely let families reach out to my office looking for help, and hearing the stories, it's heartbreaking. And no, I think that Narcan has certainly made a contribution. Is it a Band-Aid? Yes. What it does is it gets the addict through another day until hopefully we can get them to the point where they realize that they need to get well. And nothing's ever really going to happen until they make that personal commitment. Just the slavery of addiction is just so hard for some of these people that it doesn't happen right away.
Absolutely. So in terms of looking at your legislative goals for the next year as we enter into the budget process, the long and lengthy budget process, what would you like to see happen in the next 12 months to help alleviate this a little bit?
Well, I'd like to see us adopt the DEA schedule of controlled substances. Again, I think that will ultimately afford our law enforcers and our DAs, like DA Mike O'Keefe, great man, hard worker, give them the tools that they need. And let's face it, by getting people into the systems, sometimes when some of these people get in the system, that's the best break that they get. They get treatment when they go into jail. Or again, DA O'Keefe and his staff, what they do is they have diversion programs, and they can divert them into treatment as well. By getting ahead of some of these narcotics, making sure that they can't be sold unfettered on the streets, I think we'll cut down on the quantity and availability of some of these narcotics. I've heard the argument before that if we arrest a dealer, that someone else is going to step up and fill those shoes.
Sure.
Well, if they look and they see that the person just went to Walpole for 14 years, I don't think people are going to be in a huge rush to step up and fill those shoes. I've arrested people, and when they find out what they're looking at for sentences, it has a very strong deterrent value. And don't believe anyone that tells you that it doesn't. Those strict sentencing for the traffickers, the people that are profiting off of this, it does have a deterrent value.
Oh, absolutely.
And that's one thing that we're looking for.
Great. Rep. Whelan, thank you so much for coming in and joining me. And
you're the best. You're the kindest, Sarah. Thank you.
Thank you. And thank you for your dedication to this issue.
You will.
Thank you so much. You too. State Representative Tim Whelan, of course, my guest today, representing the 1st Barnstable District for Cape Media News Conversations. I'm Sarah Colvin.